Hi, everyone. We're going to give everyone about a minute or two to join, and then we'll get started. Okay, I'm going to start with some announcements. Hi, everyone. Thanks for joining us today. My name is Erin Jensen. I'm a program coordinator of community education and professional development with the Transforming Communities Institute. If you have any questions about continuing education or any questions after this session, feel free to reach out to me at erin.jensen@usu.edu. This session is being recorded and will be posted to our YouTube page in a few weeks following the session. As you're listening today, please be sure that your name on Zoom matches the name you're going to want on your continuing education certificate. This is how we track attendance, so it's important that we know who you are as you're watching this today on Zoom. To receive those continuing education credits, you must complete the follow-up survey that I'll post in the chat at the end of this session and also will be sent out via email this afternoon. So it's really important that you complete that if you want continuing education credits. And the numbers you receive on your certificate will be based on the time you spend in this Zoom. So if you're only here for half an hour, you only get half a credit. If you have any questions during the session, Jonah has asked that you either put them in the chat or you can, unmute yourself and ask. He has expressed a desire for discussion and for questions. So please feel free to, again, put that in the chat or unmute yourself. He says, interrupt him at any time. At this time, I'm going to provide the land acknowledgement for Utah State. As a land grant institution, Utah State University campuses and centers reside and operate on the territories of the 8 tribes of Utah, who have been living, working, and residing on this land from time immemorial. These tribes are the Confederated Tribes of the Goshu Indians, Navajo Nation, Ute Indian Tribe, Northwestern Band of the Shoshone, Paiute Indian Tribes of Utah, San Juan Southern Paiute, Skull Valley Band of the Goshu, and White Mesa Band of the Ute Mountain Ute. We acknowledge these lands carry the stories of these nations and their struggles for survival and identity. We recognize elders past and present as peoples who have cared for and continue to care for the land. In offering this land acknowledgement, we affirm Indigenous self-governance history, experiences, and resiliency of the Native peoples who are still here today. With that, I'm going to turn it over to our presenter today, who's going to introduce himself and share some really great information with us today. Jonah, it's all yours.
Awesome. Thank you so much, Erin. Yeah, so just starting off, oh, backspace there. My name is Jonah Nalawape Swenson. I am a licensed clinical social worker here in Cache Valley. A little bit about my background. So I graduated with my BSW in 2021. And then following that, I entered into the master's program and completed that in 2022. My experience as a social worker is kind of unique in the sense that I have a little bit of a broad range. I worked in a high school setting for my first practicum. I worked in the sheriff's department during my master's practicum, kind of doing some macro work, bridging some communication with law enforcement, and doing different things there. Then following that, I worked in residential treatment for 2 years, working towards my L. And now I am currently at the university working at the counseling center, doing clinical case management with students, kind of individual therapy, and then various different group therapy. Yeah, I'm really excited to be here today and to present on this topic. To be honest, I actually signed up for this topic a year in advance, and I was thinking about it these last couple months as I was preparing that this has definitely changed in the last year, and this is definitely like at the forefront of what we do as social workers. And so it's extremely important for me to present on this, and some of the things I'll be sharing come directly from my experiences, uh, not only from as a social worker, but also my lived experience, and then the things I'm passionate about in reading and in research. I also just want to kind of put a slight disclaimer: the things I'm sharing are kind of my own thoughts and opinions. Awesome. And so some of the objectives are just kind of redefining psychological perspectives. reframing cultural and structural norms. The first part, I'm really going to kind of poke at and deconstruct how in a Western society we take an approach to practice and research. And then towards the end, I'm going to try to explore a contextual understanding. And hopefully this makes more sense as we go on. I kind of want to just put up here the books that I'm drawing from and what a lot of the presentations about. And so, I really drew from a French philosopher, Michel Foucault, who is a kind of a pioneering figure in postmodernism. His stuff really kind of was embedded in like oppressive structures and what you see in France and how those systems can really be a detriment to marginalized communities. One of his books, specifically kind of talks about how oppressive systems like to pathologize behaviors when those behaviors might actually be a normative reaction to societal and socio-political circumstances. And so he kind of has some of like, not anti-psychiatry, but very critical thinking around psychiatry movements back then. And then kind of following into Edward Said's work, who is one of the first post-colonial theorists. And a lot of his work is kind of critiquing Western scholars, writers, and policymakers on how history has depicted other cultures in like an exotic or almost in an inferior manner with the aim of justifying colonialism. And so his work really kind of deconstructs some of those frameworks and tries to elevate the stories of those communities and those cultures and kind of draws comparisons back to how we teach in the West and how our psychologies are. And then a big part is through the liberation psychology lens, which is Lilian Comas Diaz's work. She is a pioneering psychologist known for her multicultural and feminist psychology, with a big emphasis on like ethnic minority mental health. She talks a lot about how intersectionality on like all types of systems really trickle down into the mental health. And so that's kind of stepping out for a second. A lot of my role, I'm coming at this kind of the lens of as a therapist, but also as a social worker who kind of understands how these are embedded in our micro, meso, and macro systems. And lastly, Joseph Henrich's book, he's an anthropologist and psychologist, really drawing his research is understanding the psychological differences between Western societies and non-Western societies. So I've kind of meshed in a lot of these things, and it's going to kind of be the framework for this presentation. And so I kind of just want to start right off the bat with what is a weird population. And, in this sense, weird kind of stands for this Western, educated, industrialized, rich, and democratic states. And so, myself, I'm definitely weird, maybe in both senses, but specifically in the sense of I was born and raised here in America. And so my education is weird. My psychology is considered weird. And that shapes the way I exist in this world. It shapes the way I think about things. I interact with structures, interact with policy, how I interact with my clients as a therapist. And so this will be important kind of as we move through the next slides here. So yeah, I just wanted to take a minute to kind of ask, like, maybe sit here and ask ourselves, like, who are you? Like, if I was to ask you, like, what are some identity characteristics or things that you would say describe yourself? What are some of those things? And I was hoping either somebody could shout some out or we could put some in the chat just to kind of see what that looks like.
As someone shared religious identity, for myself, I identify as a woman. That's a big part of my identity. Someone in the chat said they're also weird.
Yeah. Yeah, no, these are all great. Yeah, kind of like religious identity or like gender identity. I think of little things too. Yeah, I think yeah, these different kind of cultural identities. I think even like imagining identity like as like an onion, we're peeling back layers. Like, I have my cultural identities, my gender identity, my sexual identity. I also have, I'm a basketball lover. I'm a huge LeBron fan, like, maybe like things like that can all be considered aspects of our identity and that are, as a collection, really make us whole. Yes, like here we have white, cisgender, bisexual. Yeah, these are all wonderful examples. Yeah, housing status. Housing status is definitely one. White passing, Middle Eastern, North African. Yeah, these are all perfect. And I appreciate you sharing this. In the next slide, I'm going to kind of talk about why. Yes, biracial, Latino. Yeah, and so I kind of, sorry, I'm minimizing chat right now. Just want to, yeah, talk about independent versus interdependent identities. And so kind of in this Western framework, we're kind of psychologically tend to view ourselves as independent, focusing on like individual traits, personal achievements, and like our individual uniqueness. Sometimes it wouldn't be unheard of when somebody asks, "Who are you?" People from these cultures tend to respond with like descriptions of like personal attributes. Sometimes like professions, hobbies, or like personal characteristics. And then this is kind of counter to other cultures in the world where they're, like Eastern or East Asian, indigenous, where the self-concept is interdependent, focused on more of social roles, relationships, and connections with others. And so maybe somebody from this culture, when they're asked, "Who are you?" they're more likely to respond with like a description of their family, like, I'm Joe's mother, or I am so-and-so's sister. They're more likely to emphasize like communal roles versus like individualized affiliation. And so kind of just talking about some of the psychological differences here, there are unique traits that kind of form over time, like with perception and cognition. Weird individuals focus on objects more analytically, while maybe non-weird populations emphasize relationships and context through holistic reasoning. And fairness and cooperation, Western populations really prioritize fairness over favoring, equitable splits and punishing unfair behavior in economic games. In terms of the self concept and identity, Western individuals kind of value like that autonomy and then the independent self-image, where maybe non-Western populations emphasize the group harmony and collective action. Yeah, same with child rearing and development, independence with children and rearing practices. I think, very much the maybe like a stereotypical like mother and father household is kind of what was been seen or shown in the past, versus sometimes in other communities that I don't know if anybody's heard that saying, it takes a village to raise a child. There's a lot more emphasis on nuclear families. This also comes down to like moral reasoning with the justice and fairness again versus non-Western cultures where we're focusing on like interpersonal relationships, honor codes, and social hierarchies. And then behavior and relationships, Western populations prefer like low context and explicit, maybe like one-on-one versus like a group understanding, maybe more nonverbal cues and shared understanding around that. And this is kind of coming out of Henrik's work on the weirdest population. He goes a lot into like the anthropological research behind what are these differences. He really draws a line of like, how do these differences shape our psychology? And so how does this impact our behavioral and social sciences? So there's a huge overrepresentation of weird populations in our research, specifically, sociology, social work, psychology, these fields, where, most research from the 20th century relies on participants from Western societies. And I think this really kind of limits like how much we can generalize out and what does that research actually show and how are we portraying that in the journals and then what we are teaching. And like out of those 80%, specifically, I think in the psychology field, a lot of those are from undergraduate students. And so specifically undergraduates in the psychology field. And so I think it really pushes that question of these constructs that we have and how they actually map on to lived experiences or map on to the world, or these things that are kind of more Western centric. And I'll kind of talk about this a bit more, but here's kind of this graph coming out of Heinrich's work of just showing kind of what are some of the differences here. Yeah, and again, kind of why does this matter? I think different cultures are being misrepresented in the findings. We apply these constructs kind of with a very broad paintbrush. And so, the findings may or may not capture the diversity of human experience and behaviors. I'll kind of talk about some of the studies here. Kohlberg's stages of moral development, moral reasoning could be an example of just based off the participants that were used for this study. And so, very kind of Western centric, maybe a very one specific identity background, things like that. Um, and so kind of just breaking out of like what this looks like in our research, I think is called for. And so here's a few more of those studies that are heavily based off a Western population. You have the Stanford prison experiments, undergraduates, Stanford University, predominantly, white individuals. Milgram's obedience studies, we have Piaget's states of cognitive development, Big Five personality test, the conformity experiment, like even attachment theory. As a clinician, I subscribe heavily to attachment and what that shows for us as clinicians. But it is interesting to think about, where a lot of this research stems from, how it may misrepresent individuals from various cultures. I specifically think again of kind of like that. It takes a community to raise a child, and so for individuals coming from cultural backgrounds where they have a lot more attachment figures, maybe they're fostering a secure attachment with these individuals instead of maybe just a two-parent household or what that may look like in a Western framework. Awesome. So shifting gears for a minute, and these definitely look a lot more grainy than they did when they were smaller, but that's okay. I kind of wanted to just do a thought experiment here, leading into my next slides. And so I want you just to imagine that it's maybe it's a weekend and you get a knock at your door. Open the door and you see me standing there with a box full of pancake mix. And I am here to sell you the world's greatest pancakes. And don't just believe me, I have research to show that these are the world's greatest pancakes. And so, kind of believing my salesman pitch, I have really cool marketing and branding on this box, you decide to buy some. And so, maybe that weekend you and your family make some of the pancakes. A few of you like them, some are kind of indifferent, and then maybe a few of you really hate them. They taste like sawdust and it's just the worst pancake ever. And so maybe those select individuals, they're going to go to my website. They're going to look up to see what research has proved this to be the world's best pancake. And you see on there a study that I have done where I have created a randomized control trial where I have two groups. One of the groups received my pancakes for breakfast, and the other group received no breakfast at all. And that is the study that I am basing my findings off of. And they're scientific, and I'm using that to kind of advertise and market what I'm selling. And this is one I want to pause for a second. And these next few slides, I'm not poking at research through the critical lens of this is wrong or this is bad. Specifically right now in society where I feel like there is a lot of things coming towards research in general. My aim and goal is to show towards the end on why I believe qualitative research is just as important as quantitative. And so coming back here of just this notion of I think there's like a gold standard label sometimes ascribed to randomized control trial based studies. We see this a lot specifically in like the realm of psychotherapy. And so I had a really great supervisor tell me one time that, our clients are coming in because they want to be well. There's things going on in their life and they're not here to do better than a control group or to show efficacy in a RCT. And that's always stuck with me. And I draw that model throughout the way I conceptualize treatment, but also as I look at what our field looks like right now, because I sometimes I feel like the realm of psychotherapy is like the wild, wild west, and there's just a lot of things out there. So yeah, so kind of the limitations of RCTs. So a randomized controlled trial is an experimental research method where participants are assigned to either a treatment or control group to measure the effect of an intervention. These often exclude diverse populations, historically have really excluded diverse populations. This has recently changed in the last couple decades or so where we are trying to gather more of that quantitative research through diverse settings. But it is a kind of a catch-up game, and it's interesting to think about how far behind that might be. And so, yeah, kind of, excludes diverse populations, limiting the external validity and then generalizability of the findings within other cultures. Ethnocentrism, many of the RCTs are based off of weird populations. They are short-term focused. It's kind of showing, it's like a very snapshot of what is going on in that moment. Oftentimes they're not longitudinally, so we don't know the long-term or maybe the extra ingredients that might be taking place in change. And yeah, so kind of like that contextual ignorance, do not account for the rich cultural, social, and systemic factors influencing behavior. They're making it really difficult to generalize across different fields and environments. It's just a few more, just the narrow sample sizing. Also the ethical and practical issues. As a clinician, I always think a bit more of this one of like, these are very controlled lab environments. These are like handcraft selected individuals, through a DSM lens or diagnostical lens. They may take somebody who meets exactly 5 of the criteria for clinical depression and not 6, or, and so they're very, very particular. The time and funding, requires a lot of funding, a lot of logistical coordination, with the hopes, we can create more of a replication across different labs to really increase and secure the generalizability around it. But at the same time, we haven't looked at some of the populations and factors around that. So those are just a few more of the critiques. And so I kind of wanted to go into kind of, and this is, again, kind of through this lens of, coming into the field, and I have an interest in research. It's almost felt like there was a hierarchy where some researchers, specifically in psychology, it's like if you're not doing quantitative, falsifiable research, you're not really engaging with the scientific method. And I see a lot of that take place. And I felt that really disheartening, because I really feel like our qualitative methods are what capture human experience, the quality of life, the meaning, maybe the contextual factors of change. And so I felt that was really disheartening. And then I wanted to kind of show that, quantitative isn't the only way. And then there are some downsides to that. And I think the merging of the both will create that contextual lens. But a big piece that I found interesting was kind of like publication bias, and just the different factors there of like, studies with positive results are more likely to be published. We don't really see a lot of research that doesn't show a statistical significance being reported. So we don't have that data as it gets thrown into higher levels, such as like meta-analysis and things. So it kind of skews that. And then the article I'll show next will kind of talk about that a bit more. The only favorable outcomes reported, citation bias, you'll see then these studies just get cited more and more often. And then these things get trickled down into our practice of like, well, this is the gold standard of treatment for everybody, and this is what we need to be using. But I think there's a almost like a scaling gap here where I don't think it scales down as smoothly. And as it trickles down to the people we work with, I think that's unique to us as social workers. We are in the environment first professionals. And so I critique sometimes that scaling difference, and don't think it always trickles down the way that the wording or the way it's presented. Just as I showed up at your doorstep presenting the world's best pancakes, that didn't pan out very well. So this reporting on I wanted to pull a study here, and I also just wanted to put the caveat, anybody can pull one study and make assumptions and critiques and draw from it. My goal is really to just show how biases can take effect through here. This is not at all a discrediting anything that has to do with the antidepressant literature. It has nothing to do with any of that sociopolitical movements we are seeing right now in our lives. I put this in a few months ago, and as of this week, and I was looking back, I was hesitant to even bringing it up, but I think it's still important just to show what actually can take place in our research. And so looking at like this side over here with graph A, this is kind of like maybe a holistic lens at what the data is. all the circles are representing like a clinical trial on antidepressants. So this is with a full unbiased data set, including both of the positive, the trials that worked, and the negative, the ones that did not work. And so as we start scaling down to what gets, I think, or what we see in our society, what we see in the research lens, things change. And I'll kind of go over what that change looks like. And so from A to B, you see some circles disappear because the negative results were never published. So we're never going to see those ones. They just didn't get written up or at least published in a journal, so they're not out there for us to to synthesize or to use. And so already there, you have some of those red trials removed. Moving further to C. C is what's considered when spin has been used. And spin is anything from, using different language in the studies, like making the results seem more positive than they actually are. Like a selective emphasis. So, maybe the primary gain of what we were studying wasn't achieved, but maybe somebody had improved markers of sleep. So we're really going to talk up those improved markers and make this study look maybe more effective than what it is in reality. Another one is just the positive language, a lot of more of the optimistic use of language in the studies to make it hard to see. And for those of you who read research articles, they're not the most fun to read. Sometimes go through, skip them, go down to the abstract or the conclusion parts. And so a lot of times you will see the different use of language throughout there. Downplaying the negative findings, maybe like burying those like in the middle of the paper or minimizing them in the conclusion. Or sometimes they'll just use like misleading conclusions in general. So maybe like drawing conclusions that don't even match the data. And kind of, again, just overstating statistical significance when maybe those things really don't impact the client's life. And the last one, kind of like the citation bias. So as more and more of these green circles are being circulated throughout the research community and field, they're getting cited more often. Because they're cited more often, they may hold more weight or gravity, or more people may be using them. And then we end up with something like this over here on the right. So same data set, we're looking at the same things, but we're definitely in a different spots. And that's kind of the effects of what can happen in quantitative and randomized control trial based research. Yet again, this is not me bashing or saying these are bad. Like we 100% need quantitative, we need randomized control trials. I'm just hoping to poke at it to have a more thoughtful discussion of how we can work around some of these things. When I was I worked with a professor and they taught me, science isn't about this ultimate truth we're trying to arrive at. It's trying to continually move forward in progressing. And I think sometimes I'm not a full-time researcher, so I don't want to speak for that lens, but I think that sometimes gets lost as we really focus on, we want these results, who's paying for these studies. We really want something that's marketable, and that's what we want out there. Awesome. So kind of just like impact on treatments. I really, I don't know. I'm like a very skeptical person. I'm sometimes a skeptical clinician, and the term gold standard gets thrown a lot, specifically in the realm of psychotherapy. And I think it has its use. We know that there are definitely tools and interventions in modalities that are going to be a lot more effective frontliners for clients we're treating. I also sometimes think it can cause almost like a commercialization or like an MLM atmosphere where it's like, I got to be level 3 trained and I'm only referring my clients to somebody who's level 3 trained. And to get to level 3 training, you have to pay me $10,000. And that is always just not felt or sat right with me. Being a newer clinician in the field, I definitely have that imposter syndrome where I want to go out there and get training. And I think there are people that recognize that and they want to capitalize. Other side to that sword, this isn't me bashing anything specifically. It's just drawing awareness to how that impacts our field, but also how that impacts the clients. Because I will also see sometimes like therapists raising their prices because they are, they're level 3 trained in this. So that's why I'm going to elevate my prices. And I always put a hat of skepticism on it because your client didn't choose for you to be trained in that. We can't measure and truly know the efficacy of that. And so it's what some might consider iatrogenic harm, which is the harm caused by a medical treatment. And so it's something that's been always been off-putting to me about using gold standard and the commercialization. This happens a lot with the language of evidence-based versus empirically supported. These are two different terms. Evidence-based is where we see a lot of that quantitative, the meta-analysis, something that's been replicated far across the board, and it's still showing that significance versus empirically supported. And somebody can definitely correct me for being wrong here. I believe the APA's criteria for empirically supported is just any intervention that has shown efficacy in two different studies. It doesn't constitute what those studies look like, how big they need to be. It's just two independent studies. So those are two very different terms from a treatment being empirically supported to being evidence-based. Awesome. So kind of moving into the next part. Anybody have any questions? I feel like I've been talking a ton, so if anybody has questions or comments, totally happy to hear them.
There's one question in the chat. Someone
Oh,
asked, does this topic discuss the idea of practice-based evidence? Do you have much experience with that concept?
yes, I believe my next slides are moving in towards the so yeah, kind of the main, like it is into like the qualitative, and I'll kind of give examples of different kinds of research that I think not only trickles down into the communities, I think a bit smoother, but I think definitely deserves a seat at the table in terms of what we are funding and putting our money into for research. Things like grounded theory, participatory action research, ethnographies. I think that is actually my next slide here. So I'll talk a bit about that. But yeah, these are just some quotes from some professionals, kind of about embracing cultural humility in the research and practice. In our healing practices, the relationships we have with each other in the world are everything. Healing is not something that is done to a person. It is a process of restoring relationships in all aspects of life. Cultural competence is not just about understanding a patient's culture, but recognizing that healing practices from different cultures may be essential to mental well-being. The healing practice of communities are valid and should be incorporated into the therapeutic process. The last one is restorative justice offers us a path toward healing, but that path must be rooted in community. Healing is most potent when it's communal, when it involves repairing relationships, and when it draws on the cultural wisdom and practices that are unique to each community. Awesome. Yeah. And then so just kind of
Jonah, there's one more comment in the chat.
yeah,
Someone said, I also think it's important to think about the biases the review of the research brings. For instance, one can extrapolate the wrong results from research findings based on their education,
yeah.
experience, understanding, etc.
Yeah, no, I think that's like a wonderful example of like one's positionality or even like that being educated in here in America or like in a weird society, like that made you're taking that approach to your research lens. That's why I think the soft sciences, social sciences, psychology have a lot of it, like sometimes struggles with biasing, like p-hacking, like making these conclusions. And so it's good. I think it's helpful to be aware of these going in to really kind of be within that scientific lens and also a contextualist lens as well. So yeah, no, that's definitely a great thought. But yeah, just kind of looking at, sorry, I have my notes up, so I'm trying to like do both here at the same time. Just looking at different methodologies that are, that take this contextualist approach and also like a liberation approach of like really being embedded in our communities and working with them, working with different stakeholders, trying to find things that in my mind, the way I conceptualize it, that really trickle down, that don't lose some of the meaning here at levels of bureaucracy or academia, but that really are meant for the community. And so, the first one, kind of just engaging with the diverse epistemologies and traditions. This could be like spiritual teachings, holistic health practices that might not fit into a scientific mold the best, but are important to the cultural and the contextual understanding of different communities. I think of like grounded theory, and so this is like a inductive approach. So like unlike a traditional hypothesis driven, it's grounded in a theory that the data generates itself. So it's not like we're building off all these other RCTs. Like this is like kind of pioneering work. Kind of like challenges the top down. So instead of imposing kind of like a Western framework, it allows for the insights to emerge from like local experiences. Very and kind of very applicable to this liberation psychology as it empowers the marginalized voices, their lived experience, and in not fitting them into a pre-existing mold. I apologize. My next slide's after this are on the liberation methods. So right now, I know that's not the thing we talked about, but we'll get into it. Um, Another one is kind of the participatory action research, PAR, which this is a collaborative approach where researchers and participants co-develop their questions, methods, and interventions. So it's kind of like co-designing, having them be the stakeholders in this as they're trying to implement and evaluate. And it prioritizes their knowledge instead of a researcher's interpretation of that. It's a lot more, less of a hierarchy of here I am, here you are, and it's more of an even playing field. Um, and some examples of this, in 2004, there was a study on recasting the urban experience through participatory action research, and it's kind of reclaiming the identity for African Americans, incarcerated youth. And so during this study, they kind of really took that narrative and lived experience of what it was like and focused on really kind of like shaping that into how we can change this system, how we can change that experience, what is going wrong here, and how can we kind of work with them to see a different path forward. Kind of another one is like narrative, like storytelling. And so kind of instead of like structured interviews, like researchers collect like life histories and personal narratives. And so the researchers are kind of a part of the meaning making process instead of like that objective observer. And it can be a way to kind of just reframe, like instead of reducing people to statistics, kind of highlights their agency, the meaning and resilience that they kind of encompass. And it can really help specifically with like oral traditions, things that various different cultures find a lot of meaning in. And so, yeah, instead of maybe like really looking for like symptom relief or symptom reduction, maybe we're looking at quality of life. And we see a lot of those quality of life studies that may cut across that kind of binary focus. Sorry, scrolling down. And then you have like a dialogical ethnography. Kind of this is where multiple voices and multiple perspectives. So not just a single narrative, not just a single researcher and participant, but really getting a collection of multiple different stories, and then looking maybe at the cultural differences around there. I have examples tied in here, but for the sake of time, I don't know if I'll be able to get to all of those. So if anybody is interested, I'm happy to send the slides out or just to share some of those different examples of these research in practice. Yeah, and so kind of coming back, I think I've talked about it a bit, is just like really taking the best of both worlds here. I maybe felt like I was bashing on some of those other research methods, and I really hope it doesn't fully come off that way. I think I just really like less of a hierarchy, that this idea that all research must be falsifiable in a Western framework is extremely hard to live up to, I think, and we are going to miss out on a lot of rich experiences, specifically in the clinical settings and things like psychology, sociology. And so I think it's really important that we take both in kind of like a pluralistic mindset of we need both. We need both here to really move forward and create meaningful change, especially for disenfranchised communities and populations that have not had a seat at the table or even been studied or even explored through the research lens. Yeah, and so I kind of through that contextual lens and then shifting a bit to my hat as a therapist, one of the things I really try to break out of is black and white thinking or this has to be this or has to be this, and call for that contextual subjective understanding. And so I use this analogy sometimes with clients of like, well, maybe more in an emotional sense when a client comes in, like what does that like experience look like for you? And it's almost, it could be like any shade of these colors or meaning behind them. And so I think like even I think of like language is sometimes like a limiting factor from like the felt sense of what somebody experiences to the like linguistic or the language factor. You lose so much of that rich meaning to begin with. Like our language does not encompass what an actual experience is for somebody very well. And so I'll sometimes use these as just like a, hey, like what kind of day are you having? Is it like a pistachio green day? Is it like a lemon day? And like we create like meaning around that experience. And it really kind of reminds me a lot of a book I read when I was a kid called Frindle, where he created basically a name for his pen, and then it became like a sensation. And it's just kind of like we can create those words for our experience, and I try to do that as much as I can with clients because yeah, our language capacity is limited. There's cultural factors around that, or in different languages they have specific words for different emotions and meaning. I think there's a word in German that's like a distinct felt sense of sadness for spilling your beer. And so, like there's various different cultural contexts around words, but this is how I, in my head, imagine, you know, contextualism, shades of gray, shades of color, shades of experience. Similar with Kimberly Crenshaw's kind of like idea of intersectionality and how many different pieces and facets of identity shape one's unique experience and position in the world. And this is kind of just I'm a very visual person, so this is just like a visual way for me to understand sometimes of like, what type of day is it, or what type of experience are you having, and how can we talk about that? Yeah, and so just maybe another question time of like, how can social workers or truly any professional kind of like advocate for more inclusive and representative research in the mental health field?
Someone in the chat said that's hard to do at the moment.
Yeah, yeah, I really hear you on that one. I think, yeah, it's a it's a really tough time being a social worker and to be in this field right now. I really relate to that one. And that's another reason why I felt like presenting this right now in these moments. It's kind of tough. I feel burnt out for sure. Yes, sabbaticals. Yeah, and ultimately, I have a lot of slides, but I would love just getting like talking and getting engagement, and this topic, this lens, um, is really important, especially right now. So if anybody wants to talk or share their experience, I'm happy to hear. Yeah, like Ken with Devin, practicing awareness, using it ourselves, learning, growing in our own understanding, um, collaborating with colleagues. Yeah, like 100%. Yeah, that promote and apply research from researchers from historically marginalized communities. I really resonate with that one. I think like taking a look at this and not dismissing it, um, and like applying that hierarchical, this is what science is, but really taking a look at what other people are finding meaningful. Yes, I think that's actual engagement with the communities during the research process, like involving them, like what is actually going to be meaningful and what's going to trickle down to your community. Yeah, so no, these are all extremely wonderful, and I agree. I think it takes a lot of listening to the stakeholders, listening to people from underrepresented communities. What are their needs, and how can we create programs, or how can we utilize that through the research lens to hopefully find better interventions, to advocate for better policy, things like that. Yeah. Yeah, no, these are all wonderful ideas. I'm going to kind of move into maybe some of the liberation psychology and some of the things that I have put on for that. So yeah, liberation psychology is kind of some of the lens and focus, is a critical approach to psychology that seeks to address oppression, social injustice, and collective trauma by centering the experiences of marginalized communities. And I think that's kind of a lot of what I was hearing here in the chat. Um, so yeah, some of the key concepts, de-ideologizing reality. And so this is like the process of uncovering and kind of critically analyzing like dominant narratives that are used to kind of justify oppression, inequality, and systemic harm, and kind of challenges in the ways in which power structures, shape societal beliefs, kind of like the narratives that make that these oppressive systems are natural. This is just what we live and breathe. It's the water we swim in if you were a fish, and that's okay. We shouldn't change that. And so it's deconstructing that idea that this is a norm and that this is okay, and brings awareness to that. Another key concept is critical consciousness, and it's becoming aware of that. The political, the economic conditions, the things that are oppressive to specific communities, specifically marginalized groups. And one of the founding people I will talk about here, Paula Freire, really emphasizes that, liberation, or I mean, that psychology really should be used as a tool for liberation, and kind of breaking out of at the time where, we're using psychology to address, very symptomatic things, but really using it as a framework. How can we use psychology to bring communities together, to bring collectiveness, and ultimately advocate for new ways of community action and fighting the system, basically. It definitely recognizes historical memory and trauma. This kind of refers to the way that societies remember, interpret, and pass down historical events, particularly those that are related to kind of like oppression, violence, and resistance. And kind of understanding that, history is historically been shaped by the victors. And so understanding that then sometimes that narrative that gets portrayed a lot, kind of like what Edward Said writes about in his book, Orientalism, kind of from the 70s. Yeah, that like with that all this narrative that gets portrayed in our education is one lens, and that we don't necessarily even have access to the other stories or what actually took place or the context. And so it takes an approach of really recognizing that collective memory, cultural memory, and potentially even the traumas that have been faced. And then it emphasizes on community-based healing, and this kind of challenges that Western framework again, that, healing, it takes place in the individual. This is kind of a flip that, healing takes place in relation to others, in relation to your community, in relation to people who are going through similar experiences. And it really puts an emphasis on how can we come together, not only for healing, but also through those other statements again of like towards action, towards change. And so it has a huge focus on being in relation to others, what brings us together, not what drives us apart or individualizes us. And then, yes, again, like that social transformation, the psychology in this framework is used for a tool of activism and social change. And then just kind of, sorry, just coming through here real quick on my notes. So yeah, kind of some of the leading theorists for this are these three contributors right here. Ignacio Martin Barro was a Jesuit priest and social psychologist, kind of founder of the liberation psychology movement, focused a lot on oppression and political violence, kind of that was taking place in his own community. And so his was kind of a big focus on just making it known, like what is going on in our communities, like what are the systemic factors taking place and how is it really impacting us? And making people aware like this system that we live in doesn't have to be it. Like we can create change. And so kind of like that de-ideologizing the dominant narrative that, this is just who we are, this is our class, we have to just you just have to fall in line. And he really kind of questioned that and drew awareness towards the importance of education, towards the collectivism and coming together. Um, Similar with Paulo Freire, I hoping I'm saying that right. A Brazilian philosopher and educator, and kind of developed kind of like a framework for for building critical consciousness through education. And so instead of just kind of like a teaching model where he thought educate, you go in, you're somebody who teaches you something, it was kind of that participatory response where, let's create new knowledge together as people on even playing field and using that knowledge to really influence and change our system. And then the last one, which kind of pioneering at the time, was a French psychiatrist and psychoanalyst. And he really kind of did that work on analyzing maybe the deep-seated roots of like colonial trauma, dehumanization, and what he considered psychological oppression. And a lot of that shame and stigma individuals face internally, and how that is a direct reflection of the communities at the time, that it wasn't, no, this is a inherent, you as an individual have this diagnosis and we need to treat you, but this is him kind of understanding that maybe this is actually a typical and normal reaction to an unjust system. It reminds me of another psychoanalyst during the time, Eric Fromm. He writes, he made a statement, and this is kind of in America, as he was treating patients. Is it just to return a healed client to an insane society? Apologize for the language. That was the language he used in the 70s. But you can really kind of drawing upon that conclusion, like, we're so focused on treating individuals, treating their mental health, but then we're just returning them back to the same society where we're not looking at sociopolitical or economic or the things that are actually taking place, where we're just focusing on the individual and their mental health. And so he brought a lot of attention to the problems of that, and centering the voices again around like, hey, maybe this is a normal reaction and it shouldn't be pathologized. And what can we do to change this? And how does that change intersect with mental health and the psychological experience? Here's just a few pictures. This is Ignacio right here. This is Franz, and then this is Paola. Definitely a lot grainier when it gets blown up on my screen, I've realized. But yeah, so I kind of wanted to talk about like liberation psychology in the clinical context and clinical practice. Dr. Diaz, puts that statement, healing the self, healing the world, kind of this approach that through the unique aspect of liberation psychology is that we're shifting this focus from just treating an individual and their symptoms and their mental health to how can we treat that, but also, turn this into making somebody aware of their social setting, and how can we help them create their own change in their social setting, how that all flows into mental health. And so I wanted to talk about one of the main tools that's talked about in the book, and that they have some clinical vignettes around, is the work of testimonials. And this is a tool for resistance. It serves as like a counter narrative to challenge kind of dominant oppressive structures, allowing marginalized voices to reclaim their experiences and assert their rights. It's based around a lot of healing empowerment, like sharing your personal stories in a safe environment with others who have gone through similar experiences, or that maybe share similar identity backgrounds. And I will be sharing kind of like a clinical vignette from the researcher who pioneered this, and what their experience was like working with Latinx teens. And so, another part is cultural validations. This is meant to affirm the cultural identity And particularly, it was worked in with the Latinx and the Chicanx communities by fostering solidarity and collective memory. Um, and so, kind of like starting out, this intervention was primarily used in a group setting, so that being able to utilize the testimonials of each other in that group, just to know that you're not alone, that there are other people going through these experiences. I worked a lot with adolescents in a residential treatment center, and yeah, I think it's hard. It's hard enough being a teenager. I don't think I'd ever want to go back and be a teenager for one. All the things going on there, but also like the weight of maybe like an identity background plays on your experience. Like what does that bring to the table? How can that be isolating? And this is really cool reading this vignette, as this opened up an opportunity to see that, hey, like what you're going through, I'm going through that too, and seeing that. And so kind of just like with any typical group, you give your informed consent, the clinician kind of advising about how vulnerable this practice can be. This can be a lot. We're here, this is a safe space, the things that get shared here, we're not sharing anywhere else. Kind of in a different approach to this as well is, like I said, really removing that hierarchy of therapist client to a really that neutral stance of like the clinician participating and using the self-disclosure. So this may be, when I was reading this is kind of a bit more of a radical shift of how self-disclosure I was trained in, but how effective it was for this population. So, the therapist kind of letting the clients know he'll be sharing his own testimonial in this example, making sure the clients have an affect management background, or like some sort of skills, like, they're using the SIFT, sensations, images, feelings, and thoughts, like a practice to regulate emotions if things were to arise. So you using the clinical work to have that foundation as you're going into some of this work. But the first session, really, the clinician in this was building rapport. He identified as a Latinx man. And so using that, he shares his testimonial in the first session. And he puts in there in quotations, and I found it very powerful, is he's discussed with the adolescents about what it's like to growing up Chicano, not speaking Spanish, disliking his brown skin, and his mother abandoning him at age 2. And so kind of as a clinician reading down, like, this is kind of a heavier theme to drop on a first group, but specifically with adolescents, this is a self-disclosure that might be considered more radical than a typical Western framework of psychotherapy. But as it moves on, this opens that framework to create that inviting of like, hey, I see you for your experience, and I've gone through it myself, is the kind of tone I'm picking up as I was reading through this. And then kind of showing that the way the testimonial can be a written document, or it can also be used through art and imagery. I'll kind of show on the next slide what that may look like. But you talked about, like, throughout this group, there's like some few themes as well that come up of just like values and family and how that shapes that. But I kind of wanted to read the example. This is a real group that happened, and an example from, I think, one of the 5th sessions, when they were talking about family and what came up. And so the example was a group member drawing up his testimonial called Lots of Stuff. In this, he drew himself on the right, slouched over the table. On the left, he created pictures of bottles of alcohol. And on the right of the page, he drew his family with him pictured alone. As he was sharing his testimonial, he discussed how lonely his experience was in his family and how he believed his family did not care about him. He further stated how he wished to be in a family where they asked about how he was doing. Finally, he hoped for his parents to stop drinking on the weekends so they could recognize how their alcoholism affected his self-esteem. After he finished sharing, the group went quiet. Then one member spoke up and shared their testimonial about living in a family that he believed does not respect, love, or support him. Another member spoke up, sharing about the time about his father not being in his life, feeling isolated. And then as this went on, he described more and more people started sharing intimate stories from their lives in the form of testimonial. And towards the end of the group, kind of that to that liberation side again, the students built that cohesion, built that group trust. Started advocating, why don't we have more of these groups in our school? Why don't we have more of these in our spaces? And they ended up meeting with the principal and advocating for more groups for everybody. And that's kind of how that leads up through that like psychotherapy, that processing, those experiences, but almost back to the advocacy of like, hey, this was a healing thing for me. How do we build up more of these? And the students taking that action themselves, and that kind of came throughout this group experience.
Jonah, there's a comment in the chat. Someone
Oh,
said, I feel that until we listen to people's stories, we have no idea what their history is. Everyone's life story is so different. Reading a history book may give you an idea about a time period, but it may not be relatable to our clients' experiences. And also, I feel like it can be very healing for others to tell their life stories and family history.
yeah, no, 100%. I think that's like a really amazing point, and it's spot on here too. Of like, yeah, I think this coming back to my own thoughts as a clinician, right? Like, what am I bringing into this encounter? What am I bringing into this room? What are my own preconceived notions? And being able to bracket those, to challenge those, and to really, like you're meeting with one of one when somebody comes into your office. That is a unique person, and they have very unique intersectional experiences. And so, really listening to those, I found this one very powerful too. Of just the bringing together individuals from marginalized backgrounds and sharing some of that collective knowledge, and then being able to. He talked a bit more about how they really had that group cohesion transcended the group, and some of those kids started being able to rely on each other throughout their high school experience. I can't imagine going from a place of such isolation to being like, hey, like, I know so and so understands. I know that they're there for me now. And I think I'm a huge fan of group work. I think it can be extremely powerful. And it can be even more powerful as we intersect like a liberation background and really offer it for different individuals from marginalized communities. Yeah, thank you for that thought. And here's just some examples of what some of the art may look like. This isn't specifically, these aren't anybody's specific testimonial, but these are just the art from some Latinx artists that and I found really powerful kind of looking at them. I really enjoyed, I actually was fortunate enough to go to Sacramento to one of the art museums, and these were up on display. These two were on display. This one was not. And it was really cool. They had kind of a Chicano section that they were displaying over the summer. And this one really stood out to me, like my father's in the white shirts. And at first, I was like, aesthetically, it's super cool. I love the pink, and I kind of love like the story behind it. I relate to some of it, but there was something about it that I was like, something like familiar. And it wasn't until a kind of a Puerto Rican artist, I don't know if anybody's familiar with Bad Bunny, came out with an album in a January, and on the cover he has the white lawn chair. And if anybody's familiar kind of with the Hispanic culture, Latinx culture, what the symbolism around kind of like the white lawn chair is so powerful. Is it kind of the nostalgia, the working class, the community. Sometimes it's like the archetypes that come from it are truly powerful. And as a clinician, I love interweaving symbolism into the work I do, like what people find meaningful, and now when I look at this, I think of when I was a kid. I grew up skateboarding a lot, and we used to try to skate over these chairs. I used to sit in these chairs in my friend's basement. And it's really cool to see how I'm not the only one. Like, I know other people and other cultures really use this is an imagery for them. This is symbolic. So that's the use of art. I think it could shed light on the experience. It can be another outlet of sharing a testimonial that may be too hard to put into words. Um, yeah, so different art pieces here. Yeah, and then just coming to liberation psychotherapy, just starting out, the central goal kind of posited by Lillian is the promotion of social justice action and the integration of indigenous cultural healing and emancipatory practices into mainstream therapy lenses. So there isn't a liberation psychotherapy. You can't go do a weekend training and become a level one. But it's eclectic. This is something that you can intertwine in any of your therapeutic style. Be blended in. It does feel like a very much kind of like a humanistic or Rogerian adjacent, really client centered, really strengths based. I feel like coming from the social work field, a lot of what I was trained on feels very synonymous with what liberation practices might look like. And so eclectic and blended, it kind of does challenge the some of the frameworks around like trauma, specifically like the diagnosis of PTSD, where it kind of draws awareness that PTSD kind of fails to capture like the cumulative effects of oppression in maybe a marginalized individual's experience. There's a lot of hot topic right now around is the DSM going to incorporate CPTSD into the next edition? Kind of along that realm. It's liberation psychologists and psychotherapy recognizes complex trauma. Kind of coming back to, yes, is it pathological to have a reaction to a socio-political movement? And so it's like, why are we pathologizing behavior that might be a legitimate reaction to something going on? There's a big premise around it. Another big concept is really kind of talking about what's considered like soul wounds, and that's really it's recognizing the how things have come through history, specifically around like genocide, colonization, slavery, and how these impact individuals' experience. Centering that as a discussion topic. And a lot of focus on what's called buen vivir, which is living well or well-being. And this kind of is a promotion of like harmonious relationships between people, nature, environment, and their spirituality. It kind of predicates that everyone has the right to be healthy, free, and with opportunities to fulfill their capacities. Everybody has self-worth, and we believe that everybody has the right to express that in their lives. And this is also the buen vivir is in an interdependent context. So yes, it counter to the Western ideology that here you are as an individual, and we're going to treat you. This is a very much like healing comes through relationships and centers that. There's a big emphasis on like the psycho-spiritual healing in the various different practices that take place. I think there's many different ways to approach this. One of the ones that was often the book that I found interesting, in the Cherokee Nation, they have a healing that involves utilizing like the four directions in like a dialogue with their healers. And it's kind of using like the East is associated with belonging, the South symbolizes mastery, the West represents interdependence, and the North is related to generosity. So sometimes within this culture, the healers will kind of ask, where are you at, and use this as like a dialogue and conversation. Like, where do you belong? Who's your family, community, tribe, or nation, representing the East? Like, what do you do well? What do you enjoy doing, representing the South? And like, what are your sources of strength and what limits you, kind of on the West? And then what do you have to offer and what do you receive on the North? And they'll almost use this like intertwined in a dialogue to help kind of move through directionality or finding meaning in life. So that's just one example. There are probably endless examples out there. And I think as a clinician, being able to incorporate that into practice is extremely important. Of like, what is quality of life? What do you find meaningful? How can I incorporate those aspects of your culture and life into this practice and into this treatment plan? Big part two is just on the therapeutic relationship, kind of built on that rapport, trust, congruence, all the things that are within therapeutic relationship. But a big practice on what is considered radical humility. And that's kind of relating to your client from a human to human perspective, and less again of that hierarchy of here I am as the clinician, here you are. More of like I as a human see you in front of me as another human, and what does that look like, and managing the counter transference and transferential aspects of that. And then recognizing positionality, like the social identities, gender, race, ethnicity, sexual orientation, but alongside one's own socioeconomic status and how that influences the way of viewing the world, how it impacts the therapeutic relationship, how you view your client, how the client views you, all the nuanced aspects of that. And a big piece too is kind of coming back to the big thing of burnouts and being a clinician can be hard sometimes, and especially around cultural aspects, things like oppression, trauma, being a container to hold that for a client or being able to sit through that distress can be very taxing. So through the liberation psychotherapy, very much just as the client we're focusing on becoming interdependent or building that community, the therapists themselves, but having a community to fall back onto is extremely important. So emphasizing again, big need for self-care. And this is just kind of what the liberation psychology wheel looks like and how everything feeds into each other to create what is considered liberation. Uh, any questions, comments? Well, I think I have one more section on here that I kind of wanted to talk about and draw from. Um, oh, I guess I have a discussion question. Yeah. So what does kind of like cultural humility look like in your practice? And I'm interested to hear from anybody's background, whether you're doing therapy or whether research or whatever practice you're in. Yeah. Sorry, I just saw a question there from Devin. Yeah, that's a great question. I am fortunate and privileged where I don't. So I work at the counseling center, so we don't work with insurance, so I don't have to fully navigate that barrier. I'm very fortunate to where I can, my treatment is not dependent on that system, and I think that allows a lot of agency and kind of what the treatment I can co-construct with my clients are. Um, I think it is really hard in a capitalistic system of like how do we navigate that? What resources are out there? I'm my part of my role is case management, so I'm always trying to look to see like what do we have out there? What do we have for some franchise communities? What do we have with pay scales? And it's a challenge. It really is. And I don't know if I have the best answer for that. And so if you have any, I'd be more than happy to hear because that is it's a really challenging time. This one here, like how do you incorporate the accompaniment into psychotherapy? Yeah, I think my understanding of that term and how to use it is kind of like I said, yeah, like how do I want to phrase it? We will never as clinicians understand our client's experience to the fullest, right? Our only thing we can do is our best attempt. And I think accompanying is our best attempt at walking next to them. It's our best attempt at witnessing, witnessing their challenges and their struggles and being able to see them and knowing you're going to miss the mark, right? And I this is for all clients, I feel like too, but specifically very different backgrounds, just really trying your best to be there, but knowing you're probably not going to, and that's okay. But that consistency of showing up, creating that therapeutic alliance, holding the therapeutic frame goes a long way. There's a psychologist I follow that I really like. who made a quote, and I might butcher it, but he was like, you know, the real psychotherapy begins when your client starts feeling pity for you for failing so hard at entering into their world. And so it's that notion of like we're always going to try, but we'll come up short, and that's okay. What came to my mind with that question. Um, ooh, yeah, we're almost. Let's see. Aaron, I know we're almost at time. I can skip to kind of like just a discussion section. I had a whole another uh, section to this that I don't know if I have time for, so I may skip that and just go to my discussion side here. So,
Yeah, whatever works.
cool. I'm just gonna skip through these slides, pretend we're not seeing this. Um, this was kind of drawing. This is just going to be me drawing on a philosophy book I read recently on kind of on the Crow tribes adaptation throughout time. So that's what I was going to draw upon. Also, my thing is frozen here. There, we'll just do this. Okay, yeah, so unfortunately I'm not able to get to that piece of the presentation. Uh, got long-winded on a lot of other things. But these are just some of the questions that I came up with. I'd be interested to hear on what other people have to say. You know, one that's kind of come up for me lately is like, what are ways to communicate about equity and justice that resonate across different, like the ideological divides? And, you know, I use sometimes this carrot and stick mentality of like, I think many of us, and I don't want to speak for everybody, you know, like we prefer the stick. I mean, we prefer the carrot in that sense of, you know, we being able to be approached in a manner that doesn't feel like I'm being attacked or doesn't feel like there's a lot of resistance towards it versus sometimes coming at it from that stick lens. And I think this is why I have a hard time presenting this right now in our current given time. When I created this a few months ago, I think I was in a maybe more hopeful spot than and so yes, and this kind of also stems from my work with law enforcement as a social worker, right? And, you know, because for me that was like, you know, kind of in the lion's den a bit. We're kind of clashing in different ideologies. Sometimes we have various different backgrounds, probably various different socio-political beliefs, and I really had to find that having those honest one-to-one conversations when I was doing ride-alongs was one of the most eye-opening experiences of like, hey, like here's what I'm doing, here's why I think it's important. Like, tell me about your life, what's going on, what you think is important. Like, where do we find commonality? And so a lot of it for me was, you know, putting aside a lot of the frustration, anger I had maybe, and just a lot of the things that were going on civilly and socially, and being able to bracket that for a bit to have a dialogue and conversation. So I'm just curious how other people do that as social workers or what that looks like. And I also recognize that this is a very tough time right now to be doing that.
There's a couple comments in the chat. The first one says, this shows the values and needs for this presentation and the questions you pose. It goes back to shared values, even if those are expressed differently.
Yeah, I think looking at shared values too, and yes, sorry, I have trying to think what I fully want to share, but yes, I 100% agree. I think yeah, I'll kind of just share it. You know, I preface, I'll share my thoughts. Because I think taking a standpoint too, where being able to focus on commonality again, right? And I think in the last few years, and it is really important. I don't want to diminish that. We have a huge focus on identity, and I think that is extremely important. But also, I think sometimes we've gotten away from socioeconomic pieces as well, and what it's like to sometimes bring commonality around that experience. may open the door to having more of a conversation across this, what feels like a huge divide right now. And at least in my experience, I feel like that's been, well, how can we find some commonality and then really in a time where I think we need to try to find something.
The
Um,
other comment really builds off that. They say being focused on values and personal experiences can be really helpful. The Leadership Lab in LA is a great example of that to me, where they go door to door canvassing people about social issues and learn how to understand people and voters in short time frames and work to help them understand other perspectives.
yeah, yeah, I think that's like a perfect example of like, being out there, being door to door, like seeing in real time, um, what are going on, what are the values, and how can we have a conversation around that. I think we also live in one of the most unique times where we're the most disconnected, connected societies where we have the most opportunity for connection through our technology, but yet we are sometimes what feels like the most disconnected or polarized or I'll be honest, I find it challenging sometimes to find information. It seems like we live in a lot of huge bubble of things going on. And as a clinician, sometimes I feel like what I see a lot too is a high emotion cell, high emotional reaction, whether that's whatever range we're looking at is what we see a lot of our social media, and it's embedded in what media use we have. So I think that door to door personal connection is really cool.
Someone
Yeah,
says, I love that idea of bridging the gaps. And I also feel at this time I'm leaning into community art people that are just about building a more just world.
yeah, I think that's a perfect example too, and I think that pairs well. At least how I'm interpreting that is like, yeah, it can be pretty easy to get burnt out, not only from just the work we do, but what's taking place in the world and the lack of control it feels like. Um, it can be a lot. So I think leaning into those communities where you feel heard and represented, and also feel like you're making change that you can be a part of, is like a reinforcing cycle where it's almost like engaging in self-care, but engaging in something meaningful. Yes, Devin, I 1,000,000% agree with you of reframing, focusing on accessibility, representation, collaboration. Yeah, when I did this presentation too, this is like very unique time in the last month. The term DEI or EDI has become it's been blown into this social sphere now. And I always did my colleague kind of phrased it too in working with people that may not be fond of that term or may have some preconceived notion of like breaking it down of like, do you at a personal level have anything wrong with diversity, with equity, and with inclusion? And trying to drag back from what maybe people have under this ideology of what DEI is and come back to like how it's actually helping in these lenses and what the initial goal was around these movements. Yeah, so that's a really great thought. Um, let's see here. Yeah, I don't know. Does anybody have any thoughts on like how oppressive systems manifest in direct care or in practices you've been at or you've seen in your own life? Yeah, policing people's behavior. I'm curious. Can you expand on that one a bit more? I'm curious on that.
Oh, can I unmute?
Oh, yes.
I did. Okay. Oh, maybe it'll be easier to speak it. But I was just thinking how oppressive systems can show up in more like implicit ways where often Western norms are sort of imposed on people by saying, oh, like that behavior is not acceptable. Like you have to tone it down, or you're not allowed to express emotion in this way. Um, and maybe people even lose access to care because they're being interpreted in a certain from a certain lens, whereas if it wasn't through that lens, then they wouldn't have been denied care.
Yeah, no, that's a wonderful point, right? Like what framework are we bringing in? Does this fit my box of how you should be acting right now? And if you're outside that box, I'm going to label you this, or I'm going to pathologize that. I think that's a really great picture. Uh, yeah, I think that's a great point of like how organizations are structured, people communicate, which ideas are prioritized, how people access care. Yeah, no, I think those are like really great as well. I think even too, like like even like microaggressions too, that I think of people, I would work with clients who like it's become such a norm in their life that they don't even, realize that. They come in and it's that's just, that it's just another day for me. And really like that the testimonial work or through any narrative work or just kind of like what's it like to tell me more about like what it's like to have that and I think it's just one small piece of some of that lived experience of what may go on for individuals from marginalized communities and how a day in their life may be vastly different than, in my life, what they have to just go for. Oh, I'll definitely have to look that up. Thank you. Um, yeah, so definitely I think a much needed discussion, but I definitely recognize right now it feels like it feels hard. It feels like a heavy topic to have. Um, yeah, I'm interested if anybody else feels that way and what they are doing. I really like that idea of kind of like leaning into communities that are feeling uplifting right now, um, self-care and practice and things like that. But coming back through the lens of liberation, that main focus of community, right, in uplifting each other. I think more than ever right now, I think we do need some of that. And so finding those communities, those spaces, people to lean on, the programs, things like that, really do go a long way. But awesome, yeah, that's kind of everything I have. It's been a pleasure. Sharing some of this information. I apologize I didn't get to the last one, but yeah, great.
Thank you, Jonah. This has been awesome. I think you've given us all a lot to kind of reflect on and think about. There was some desire in the chat for your slides, so if you don't mind sending those to me, I can send those out to everyone
Yeah, of
so they
course,
can reference back.
for sure. Yeah, I'll definitely get that sent to you.
Great.
Awesome. Awesome.
Reminders for everyone, I've put the evaluation link in the chat. I'll also be sending that out today via email. And then our next continuing education session is on Friday, March 21st from 12 to 4. It's going to be our social work mini conference. That'll be an opportunity to earn 4 continuing education credits, including an hour of ethics and an hour of suicide prevention. And that information will also be going out in the email this afternoon. So thank you again, Jonah. This was really great. I
Yeah,
really appreciate your time and your expertise in sharing it all with us.
yeah, yeah, thank you.
Have a good afternoon, everyone.